Hello, I'm George English, the Director of Research Through People. The COVID-19 pandemic has made us realise just how important health is to all of us, both our own health and the health of the nation and indeed the world. And people ask me, well, how can tracing our ancestors and family history and genealogy and research like that help us with this? And the answer is it can. So we've made this video to share our knowledge about this. Now, as well as genealogy, I've actually worked for the NHS and for worldwide healthcare organisations. So it's given me some insights that perhaps I can share with you. So we'll talk about health in the past and how it relates to where we are nowadays. So, health in the past, and so we're going to give you examples of health in the past. And health was a much more precarious thing for our ancestors than it is now, because of staggering medical advances that have been made in various times, etc. We talk about the NHS, which has actually only existed for just over 70 years and has made such a dramatic difference. And then we'll lead into how family history can help, particularly with your health, both yours individually and in the wider sense. So let's look at the past and where we get records. So death records tell us a lot. Tuberculosis was such a big problem in the 19th century, and here we have someone, Margaret, aged 24, has died of phthisis pulmonis, the official name of tuberculosis. You know, someone in the prime of their life, just starting. Bronchitis. Here we are, someone 59, but acute bronchitis, pulmonary congestion. Interesting enough, an iron miner, you wonder whether that was work related, but you know, these are diseases that were really, really serious matters in the past, which thank goodness are now no longer. Child deaths. This actually is a birth register from Australia. There were 5 deaths on, sorry, not birth, deaths. 5 deaths on this page, 4 of which are young children. You can see here we are, a male 6 hours has died of debility. A female 1 year 3 months of teething and diarrhea and exhaustion. A male of 6 months gastroenteritis. Male of 1 year 8 months tuberculosis. There we are again. So this was back in the 1870s. Old age. Well, no, I put this in because they were 1845. My male of 80 died of old age. You wouldn't be allowed to say old age these days, but sometimes eventually people wear out. Now, in the past, here we are, 1858, James dies age 65. Supposed inflammation, no medical attendant. It can happen these days, but very, very unlikely, whereas in the past, much more likely to happen. So all sorts of reasons for death that wouldn't happen these days. One of the big things that happened in the past, in the 19th century, was the Industrial Revolution. People flooded to the towns and cities. London grew in population in the 19th century, from 1 million to 7 million people. Tremendous influx that was just too much to cope with. Poverty, there were millions overcrowded in slums, particularly in the East End of London. Life expectancy, I was talking to someone about Shoreditch, the early 1800s, the life expectancy was 23 years. That was partly dragged down by child deaths, but nevertheless, you can imagine, just as you're starting your life, you lose it. And the diseases that kill people. Now, interesting enough, in the slums, in 1848, Hector Gavin wrote a book called Sanitary Ramblings. He just walked down the streets and recorded what he saw in Bethnal Green and other places, the cesspits, the dirt and so on and so forth. And gradually there was a growing awareness where people like him helped. In 1854, cholera was a big problem, and Snow removed the pump handle. Snow suspected that the contaminated water was the cause of cholera, wasn't quite sure, but removed the pump handle in Broad Street, and this dramatically stopped cholera. The last cholera epidemic was only 10 years after that. They discovered what was causing cholera. In 1858, the Great Stink. Parliament did very little about this until the Thames became so smelly outside the House of Commons that they decided to do something. And in 1875, a new network of sewers was opened up that made London a lot healthier than it had been in the past. Now we look at old maps, and we very often put old maps into our reports. Now here we are, Morpeth in Northumberland. There's the county lunatic asylum. Mental health problems in the past, you were just called mad. But even things like dementia for old people, they didn't know what was causing it, so they got shut away in the county lunatic asylum. With the health, here's Newry in Ireland, and here's a map, the fever hospital. This is where the people with smallpox and tuberculosis and measles and so on got sent. Of course, we have no fever hospital these days, thank goodness, because the reason for it has disappeared. Here we have the Union Workhouse, and we have the National School. Schooling was just coming in. There was a national model school there, which is another story. And let's look at the medical advances that have happened. 1800, Jenner brought in the vaccination for smallpox. Smallpox used to kill something like 10% of the population. They estimate that vaccination has saved over 500 million lives. Anesthetics. In the old days, you had your leg amputated, you were given a bit of wood to chew on while they did that. 1840s, anesthetics came in to dull pain and so on and so forth. And we just take for granted nowadays if we have to go to surgery. Louis Pasteur gave his name to pasteurization. They were learning. Disease was there, etc. The importance of cleaning things and so on. Lister, the Scottish surgeon, known for infections in surgery, getting people to clean and sanitize the equipment and so on and so forth. Blood transfusions came in about 100 years ago. Again, able to replace blood that was contaminated with new things. Diphtheria and tetanus. Vaccination for that came in 1926. Saved 60 million lives. Fleming with penicillin, reckoned to save 80 million lives. Salk introduced the polio vaccination, which has virtually eliminated polio from the earth. Measles, they reckon 120 million lives. Phenomenal, the importance of vaccination and the medical advances that we have made. And then the NHS came in 1948. We'll look back, here's a life expectancy table. In 1841, average male lived for 40 years, the average woman 42 years. Women have always lived longer than men. And then we get this graph, gradually the age is going up. In 1948, the NHS is started, and you can see the immediate impact on the life expectancy, particularly for two main reasons: health improvements in the young, immunisation, vaccination and so on, and in the old, heart disease and these sort of things being treated. So working well at both ends. And if we look at the NHS, just in those 70 years, the life expectancy has gone up by something like 14 years. We're getting much better at preventing things now, testing and finding out before they get too bad, and much better at treating things like cancer. Still dreadful, but we pick them up more easily, and we're able to treat them more. And so that's the world that we live in. Now, good health, they do surveys, is the #1 priority for people. But 60% of the UK population is now overweight or obese. We let's just go back 2 generations. The poorest people were the thinnest. Now they are the most obese. And obesity brings all sorts of problems: heart attacks, type 2 diabetes, greater risk of death from coronavirus. So there are very real problems if you are overweight. And if you look at the NHS and the treatments and things they do, we could actually halve the costs of the NHS if people really looked after their own health much better. And so that lesson is relevant to family history because we can learn from it by tracing our ancestors, what they die of, childless, where they live, what jobs they did. We can learn more about them. We can particularly learn of what they lived through. And I think this quote is quite a useful one: those who do not learn from history are doomed to repeat it. So what can we learn from their experience? Well, we can learn basically about how important health is, but also, of course, their lives in general and various things. Maps of where they lived, and I've shown you the maps of Newry and Morpeth there. We can use it in a personal sense in setting goals and strengthen your motivation. Losing weight is something most people talk about. It's not as easy as that, is it? But if you look at what's happened in the past, hopefully it will help you be more motivated to say, I'm not going to do that. And a very important question in family history is, what is the evidence for that? We live in a world of social media where there is so much uninformed opinion, fake news, deliberate lies. What do we believe? So when someone comes and says something, ask, what is the evidence? There are anti-vaccination people. Ask, well, what's the evidence for anti-vaccination? Of course we should question, but look at the game-changing case that's been made for vaccination. We're so lucky to live in this age, and try and be informed, objective and balanced, and learn from things. So I hope that's been a useful insight. Family history can be beneficial in all sorts of ways, and if this helps to make you healthier, then that's all well and good. So please feel free, if you want some help looking into your own family, to get in touch with us. When you do, we have a free consultation. We look at the information you send us and what we think are likely to be able to achieve, and we give you options, because what's very important is that you know how much it will cost you, and we know how far to go with the research. We've got a 10% introductory discount at the moment. Just quote Explore One, and please get in touch. We look forward to helping you and helping you to be healthy. Take care.